Your genes hold the answers to your family's overall health. I'm Dr. Paula Krupstad, and on the Get to the Root with Hope for Healing podcast, I sit down with experts in genetics, functional medicine, and family care to explore what's really going on beneath the surface so you can stop guessing and start healing. From personalized insights to practical tools, we bring you whole family wellness that starts at the root. Welcome, everyone, to the Get to the Root podcast. This is Dr. Paula Krupstad, your host. And how appropriate that I'm struggling with laryngitis when I get to speak to a dentist. So, how funny is that? So, welcome, Dr. Katie Toe. She is a biological dentist, and I'm so grateful she's here. Welcome, Katie.
Thank you so much, Paula. This talk is way overdue. We've known
Yes,
each other for so long. So yes.
yes. And it was interesting. I got onto your website, so I'm just going to give a little bit of an introduction, but I think what will be really encouraging to everyone in our listening audience is your journey, your personal journey, and how that translates to care for an entire family. So, Katie went to the University of Texas at Arlington, and she earned a Bachelor of Science in Biology. And then she went to my alma mater, the University of Texas Health Science Center at San Antonio. I went to the med school, and you went to the dental school. And then Katie went on her own personal wellness journey. So I would just like to start there and have you tell us your journey in traditional dentistry and how you ended up as a biological dentist.
Yes, by reading my bio, you can definitely say I'm a very good student, straight A, graduate
Yes.
with honors and distinction in research. And now looking back, I actually laugh at my research because my research was on fluoride, how amazing fluoride is. And now I'm don't practice with fluoride. So life is really testing you. And so when I was in school, I believe that school teaching me everything I need to know. So when I went out to practice, I know so much already. And it's really hard when you become the patient. I actually became a patient myself in 2018, got really sick, and the healthcare system said, nothing wrong with you. Everything looked okay. But I know deep down inside, I was not okay. I know that that's not who I am. My memory, my foggy brain get really bad. My fatigue, which is unbelievable. I'm dreading getting to work, get out of bed. And I know that's not who I am for my whole life. I was always high energy, always talk fast, walk fast, eat fast, even though I know I'm not supposed to. But a lot of patients also agree on this. They know when their body change, and they know this is not who I am. I feel different. I feel weaker. I feel not myself. And when you look at the blood work, really nothing show up. Number one, because the blood work was not cover everything you need to see, but it's also what normal is not optimal. We learned that
Yes.
what normal is not optimal. So everyone say I'm normal, but I know I'm not optimal. I'm not my own self. And that's when I found functional medicines and were diagnosed with heavy metal toxicity.
Mm.
And I was given a choice of either quit dentistry completely because it's making me so sick, which is I never heard of. And to be honest, at that time, my family and I thinking we met a quack. We're like, we never heard of that. Like, who said heavy metal toxicity? And the symptoms are just so similar to other condition. And then we had a second opinion, third opinion, and obviously everyone said the same thing. And that's when you become denial to like accept the fact that that's what I had. And so I had to quit dentistry because it made me so sick, or I had to practice differently. And so a lot of us, when life gave us that ultimatum, like you either quit or do differently, most people quit. I have friends that quit because they're so sick. Then there's people that say, no, I'm had to figure out a way. Right. And so that's what I chose to figure out a way. And that's how I found biological dentistry and the
Oh,
community that embraced me and helped me. And you one of those members of the community who taking care of my kid and also support what I'm practicing and take care of a lot of our patients. So I'm deeply grateful for this journey because at first, the beginning journey, I thought, why this is happening to me, right? You was in a very confusing state where you're like, why me? Why this not happen to others? And then I realized that a lot of dentists struggling with this, with
oh,
toxicity, with autoimmune, with heavy metal, with infertility, with thyroid problem, and they could not pin it to what causing it.
Katie, let me stop you there and ask you a question. You said you found out about heavy metal toxicity and you're like, oh, this could be a quack. And then you went further. So, what kind of testing did you have done?
Yep. It's very interesting because three different provider do three different tests. And the first provider, she did a provoke test with the lab that Genova. And
Hmm.
so I did the challenge test, collect the urine for 6 hours, and then tell us like the lead and the mercury and a bunch of other heavy metal. The second doctor did the tri test from quicksilver, hair, urine, and blood, but not a provoke test, not a challenge test. And then the last doctor did the test with doctor data, also with the challenge. And that's how the test result was conclusive that yes, you had heavy metal toxicity. And since you have no metal in entire body, not from any medical device or medical or dental procedure, I don't even have any restorations in my mouth. I
So,
was born and raised in Vietnam, so I have all my wisdom teeth. And so that's the conclusion is coming from my work, which is dentistry and how we remove heavy metal from amalgam restorations. And that's where I got it from.
Ah, so as far as your recovery too, your bio talks about infertility, and I have the privilege of caring for your beautiful children that are miracles.
There
But
you go.
yeah, so what kind of treatment did you go through to chelate, pull all those heavy metals out of your body?
Yes. So, of course, the first thing is we talk about chelations. I was
Hmm.
very hopeful because I'm like, oh, they can go in and pull all this heavy metal out of my system. And that's also a big mistake where we did try that without understanding our DNA analysis. And this is why both of my children had DNA analysis when they came to you, because we know without the map, we will try to figure things out and not knowing where we're going. And so immediately we pause and get the DNA testing done and redraw now that we have the information from the DNA, and knowing that I'm not methylate well, not detox well, not having a good support pathway. So we're going to go ahead and do it slower. So we've been doing through nutrition, sauna, and also low dose of EDTA versus a higher dose of chelations in the vein. So it's been a long process, but what I notice is my symptoms start getting lightened and I start seeing the difference. I think that's the most important is you feel the progress and you know, especially with the annually testing, we know the numbers are going down. This is the reason why people thinking, oh, I can just get this done in a short period of time, but healing takes times. And a lot of times you have to listen to your body and know your genetic markup to know, can you go fast? Can you go slow? And a lot of time that's what really stop people from healing because they don't understand that component, which is your gene is your map. It's not your destiny, but definitely a map to tell you how you should go.
I really appreciate you bringing that in because, our sponsor is Fagron Genomics, which, and then our wellness blueprint. And it's so true. It's like we, especially as medical professionals, you want to cross the finish line, get it done fast. But like you said, using a lower and slower approach with EDTA, which is a chelating agent,
Mhm.
instead of doing it IV and very fast, but setting the stage for success, lowering the inflammation in your body, getting your cells working,
Yeah.
getting the proper B vitamins working, and
Yes.
just giving yourself nutritionally what you need. So that's so encouraging. So, what happened as far as getting back into dentistry? How long did it take you once you discovered what the challenge was moving forward? And I know where you are now. You have this beautiful, thriving practice. And it's interesting. Katie's first name is Katie, Dr. Katie Toe, but she's in KT, Texas, Katy.
Yes.
So um, tell us a little bit about that journey once you discovered the diagnosis.
Yes, when I was given the choice of a quit dentistry permanently or practice differently, I was asking the question, what differently mean in dentistry? And that's when the community of biological dentistry just open their arm and say, come here, let me show you how we've been practiced this way for 40 years. And I'm like, oh my gosh, I was completely blind because I thought dental school was teaching us everything we need to know about practicing safely and helping patients and also protecting ourselves. But I was not really get the information from the dental school from protecting ourselves and our patient. I jump in, I would say 150% or 200% on transform my practice from a conventional practice to the biological practice at the same years I got diagnosis with heavy metal toxicity, which is 2018. Because the reason is you cannot, once you see it, you can't unsee it. When you see it, you can unsee it because now you see mercury is not just what in the metal, but it's in the vapor. You can't see with your naked eye. So we had to use special respirator with mercury vapor filter. We had to transform our practice with the intraoral sections, extraoral section with mercury filter. And what happened in 2020, we all know COVID. And we
Yes.
had all the equipment. If we are mercury vapor safe, we are COVID safe. So we have the respirator before the world know what respirator is, an N95. We have all the PPE to use during mercury removal, and that exactly the same PPE that the hospital using during COVID. I remember during COVID, we donate a lot of PPE to the hospital, and the hospital personnel that came to our practice was like, your practice have more PPE stuff than what we have right now for COVID. It's because we prepare and we know that this is the way to protect not just the patient, but ourselves who have actually repeated exposure every day
Yes.
with this heavy metals and chemical. The dentistry is quite toxic, and we did not get that training and that protections in school. We thought everything is normal.
For our listening audience, would you define PPE?
Yes, it's personal protective equipment.
Yes.
Yes, yes, like
Yeah.
your gown, your mask, your head cover, your shoes cover. We literally go into procedure when we take our mercury removal procedure. It's like a biohazard.
Yes. Yes.
Yes.
Yeah. I remember growing up playing with mercury from a thermometer, and people just did not know the toxicity of it. I remember when I first started into functional medicine, the first patient that I did a provoked test, and we were searching, and it was a cracked mercury amalgam in her mouth. But the amazing transformation where she felt so much better after pulling that out of her body. And we did it orally, we did not do it IV. So Katie, the acronym for SMART Certified Dentist, you just explained it, but can you tell us what that acronym is?
Yes, SMART stand for Safe Mercury Amalgam Removal Technique, SMART. And that protocol was established by the organizations called IAOMT. They very vocal about getting rid of amalgam, which is 50% of amalgam is mercury, and get rid of that completely in this country. And we finally get a date. The government set a date in 2030 to get rid of the amalgam mercury fillings in dentistry. 2025, the entire EU banned it. 2009, entire country of Sweden banned it. So we really behind on a lot of these, I would say, public protections in terms of toxicity and mercury in the water, mercury in the mouth, and also mercury in a lot of medical procedure that we know, especially the vaccination. So.
Yes, yes, and vaccinations are near and dear to my heart as
Mm-hmm.
a board certified, pediatrician, that we're adopting more of the European schedule to where we stop putting these toxic, they're called adjuvants, the additives in the vaccines into children's bodies and adults too. We have so many vaccine injured people. Now, what would your message be to, let's just start young. I know that you're not a pediatric dentist, but being a biological dentist, all the principles translate from womb to tomb, as we call it. And I have family practice providers in my practice too. And I I see adults as a consultant, but the principles of functional medicine, just like biological dentistry,
Mhm.
translate across the ages. So, if you were speaking to the parents of a child that was around a year of age and this little one had a few teeth, or let's just say closer to 4 to 5 months of age, we've got little baby teeth erupting, how would you talk to them about how to take care of their little one's mouth?
Yes. First principle, I've always said normal is not optimal. If you go into a conventional or mainstream, say pediatrician, then they said your child look normal, and they don't look at, a comprehensive, say the way the child breathing is the mouth breathing is a problem. They only look at the body weight and the percentile, the height and the head size, and that's it. And then pushing you on shot, that means you're missing out a big part of the growing development. As a biological wellness dentist, when we look at a baby around 4 or 5 months old, we know that baby when that child was born, we know immediately if that child have tongue tie, cheek tie, we call buccal tie, and especially tongue tie, lip tie. All that tiness, there's a bigger indication. Paula, you test every single child DNA when they come to your office because my daughter, 2 days old, got her cheek swab, and we know so much about her and how to support her. The tie also indicating there could be a methylations issues, we call the MTHFR, and that means that that child would have a different way for you to prepare, especially with all the toxicity and all the food and all the things that we thinking it was good, right? We think it's normal, but it's not optimal for that baby. I have two baby, and the first one and the second one, same mom and dad, and they have very different way of the body express their gene. So
Yes.
we got to learn about that bigger pictures and not just look at the child in front of us and say, oh, he's breathing, she's growing, she's gained weight. I think that's everything's good and normal. And so at 4 or 5 months, we already know at birth if that child have any cheek tie, tongue tie, lip tie, if that child using the neck to swallow or swallow with the tongue and not a lot of cheek in the lips compensation. Is that child breathing entirely to the nose, or is also have the dry lips and bad breath because children's not and no one's supposed to have bad breath if your lip closed at night. So those are the things that we're looking for. Also, when I had my daughter come in for her checkup with you, you spend entire hour looking from head to toe, and I love that you're not just looking for the problem, you're looking for also opportunity to optimize the growth and development. And I think that's the difference between normal and optimal. Is like we don't want to wait until the child have problem because that's what we call sick care. We're looking for the child opportunity to optimize that growth, that super gene, that nutrient that they could have more and make the brain and the body grow stronger and smarter. And that's the approach we should for every single child is that optimize their health.
That phrase, opportunities for optimization, I think I'm gonna start, I'm gonna adopt that. I love
Yes.
that.
Yeah.
So if the parent doesn't go see someone who's cognizant and aware of airway issues, what are some of the things that they might notice with their infant when they come out of the womb as far as head shape to posturing and
Mhm.
then how they nurse? So let's kind of hit all of those. You alluded to it with the neck, and so let's hit posturing,
Mhm.
neck, and then the way that they may nurse or their inability to nurse.
Yes. I remember as a mom myself, I always take the ownership and the responsibility when my child not nurse well or I don't have enough milk. And no one ever told me, especially with my first, which is in 2016, that, oh, it's because he have a tongue tie issue. That's why he doesn't nurse well. That's why it hurt. That's why he's not full and he's tired because he's been working so hard just to get the milk. And then therefore they told me just to switch him to bottle instead versus look at the root cause, which is his tongue, his lips, his cheek type, his posture, telling us to work with lactation consultant that actually outside the hospital, who actually will be able to tell you a lot more than someone work inside the hospital. Also work with pediatric chiropractor who understand the postures and how to get that alignment early on, because most of our children have that compartment syndrome, right? They would sit in the car seat and we swaddle them and everything's in the womb is so tight and we're never releasing that and be able to adjust it. So for me, a lot of parents just don't know that they have options. They don't know that they could get the DNA testing on day 2 when that baby was born. They didn't know that they could go to someone outside the hospital for a lactation consultant to evaluate, or even a pediatric dentist who specializes in ties and revision. One of my partner, her baby was born and have immediately evaluated for tie and have all this adjustment done within 2 weeks of life. And it's make a huge difference. The child not snoring, the child doesn't, having colic problem, the child sleep through the night. Every time that he fed, he's get full. And so he doesn't get fussy. And a lot of time moms finding solution, but it's a short-term solution, or it's like patching, like the nipple cover, like things that we like, oh my gosh, it's our problem. But it's in fact, it's the child could be optimized, could get help early on. So I think parents need to ask questions versus thinking like, I need to go out to the store and buy the bottle and buy the good bottle. No, let's make sure that the child doesn't have issues with feeding versus make it easier for them and ignore the tie issues, which is related to the jaw growing. Because all my patients who have orthodontic treatment are not getting the tie problem addressed when they was born or when they were young, and it lead to narrow jaw, lead to no room for wisdom teeth. Therefore, wisdom teeth had to be extracted, or even worse, premolar had to be extracted. And then that lead them, prepare them for sleep apnea in their 30, 40. And we've seen patients with sleep apnea problem or airway problem really young and never really have any one diagnosing them properly. We have
Yes.
a cheerleader in high school with chronic clinical depressions and put on medication, and no one ever thought, oh, it's because she didn't have enough oxygen. And so there's a lot of course, ADHD, all of that hyperactivity is all causing by the child didn't get sleep because they grow in this sleep. And so a lot of
Absolutely.
parents thinking, I think my doctors say my kids are fine. So when someone say, hey, you need to look into this, they either dismiss that information or they miss the opportunity to do
Yes.
that when the child was
Yes.
young. Yes.
Yes. I think what you said about a mother blaming herself, mother
Hmm.
guilt is so much part of that. And
Yes.
how are you to know that your baby's airway is restricted? So here I am at age 62 in Invisalign, having gone through profound expansion
Expansion.
and
Yes.
excellent dental hygiene, but I fractured numerous teeth. Just had a tongue tie released, but you can see all the accessory muscle use that has gone on through the years. And yes, sleep apnea and using a CPAP to keep my airway open and having struggled with clinical depression. So
Mm.
the root cause analysis is so important. And there's so many hormones with pregnancy that you blame yourself, you get depressed. It's so sad. And so if every child who comes into our practice, and you alluded to this too, we think airway when they present with ADD, ADHD, they all need a good airway evaluation. And sometimes too, can you speak to us about people who have what's called a submucous tongue tie, where there's actually, when you look, you can't see tethered tissues, but explain what might be evident, because I see that a lot too. I know what that is, but if there's no tissue that's visible causing an actual little piece of tethered tissue for people to see, I'd like you to explain that, Dr. Katie.
I'd like to thank Fagron Genomics for sponsoring our podcast. Without knowing what your precision genetics are, you don't have a roadmap. So please log on to our website, schedule a welcome call, and see what the Wellness Blueprint can do for you. That's the premier and proprietary genetic panel that Fagron has allowed us to create.
Yes, because there's anterior tongue tie and posterior tongue tie. So a lot of people thinking they're all looking for the front and forget about how the child be able to lift the back of the tongue up, because that's part of the tongue when you lay on your back is what obstructing your airway and causing either you had to flip on your sides. I've seen some people sleep on their belly and they think it's normal just because they can wake up the next day and they think sleeping on the belly is normal. And so a lot of parents, when they look into the child mouth or a provider that don't have training in classify, so we talk about provider have different level. They have identifier, classifier, stabilizer and healer. And so not everyone can heal everything, but at least you have to identify and then learn how to classify this. Because if you identify that this child don't have anterior tongue tie, but you don't know that there's a possibility that this child have posterior tongue tie, you're not going to send that child to the right provider to get a full evaluation. So for parents, I would say if you are suspecting of your child, you have a history of, I always look at the parents first. If you had orthodontic treatment when you were young and you marry and your spouse also have done orthodontic treatment when they were young, then that means your child more likely will need orthodontic intervention if we don't intervene early. Every time I meet an adult patient, I said, I wish I met you when you were 5 or younger, because we don't have to do this jaw expansions and surgical approach and orthodontics and reverse a lot of the teeth damage by restore them with dental material. It's way more expensive and the damage already done by the time I met them in their 20, 30, 40. And so I always joke that I wish I met them early in life. And this is the chance for them to look at their kid. And regardless where the kid are, you can pass on that knowledge and start investigating, start gathering a team. It's never one provider. It's always a team of providers that have the same philosophy, even better if they're talking to each other.
Yes,
Because
yes,
patients feel like they have to do all of that communications where provider don't communicate. And I think in the functional biological world, we all know each other. We all each other patients. We all each other friends, and knowing that our journey, we can practice alone. And so I love that the patient love that we're communicating. We know each other. We go to each other practices. And the fact that you cannot treat the patients alone, you need a village.
yes,
And so, yes, I have a lot of patients ask me, who do you take your kid to? And I said, I take my kid to Dr. Krebstat. And so I think that's another way for them to know that you not just talk, but you walk the talk. And
yes,
they also want to know who you work with because they're looking for that team. And
yes,
so I love that. I feel so blessed to be in Houston area when we have a lot of brilliant provider who also
yes.
patient themselves, who also went to this journey themselves. And the fact that you went to all this, it's not a short treatment, it's years of treatment. And you're still in the middle of it.
Yes, yes, exactly.
Yes,
I so agree with that because you need to find lactation consultants
yes,
that have had oromyofascial training.
that's right.
Y- We may, for older children, need an oromyofascial trained speech pathologist who
Hmm.
understands this and partners, and then find airway specialists. And
Yes,
then we have body work specialists, as you alluded to, the chiropractor. And then
yes.
my husband sees you. I have another biological dentist that I
Hmm.
started with on the north side of Houston
Yes,
already. And so it's so true. And, then too, if we need to pull in an orthodontist,
that's
and
right.
then if we need to pull in an oromyofascial, um, an oral surgeon is
Surgeon.
what I was starting
Yes,
to say there, an oral
yes.
surgeon, but all the while optimizing individuals' health. Something you said earlier that no one should have bad breath if they're closing their mouth at night.
Hmm.
So can you talk to me a little bit about bad breath?
Yes. Bad breath could be number one cause of bad breath, definitely mouth breathing. And in fact, we just reposition number one cause of cavities, also mouth breathing, because it's way more common than people that not brushing. In fact, people know about brushing and flossing and they do it, but they still come in and said, my child, myself have bad breath and I'm so conscious about it. And I try everything and it doesn't work. So the first thing first, if you breathing through your mouth, you will alter the oral microbiome, especially you are facilitate the bad bugs to grow and multiply so much faster than the good healthy microbiome. So that happening every single day. So your body cannot compensate fast enough for that. Another trick I do is in the morning, I smell my child, my children breath, and I can tell you that if they have their lip closed, they don't have any we call bad breath or periol or gum disease smell. But if they don't have their lips closed together, you were the one that brushing for them the night before, you flossing for them the night before, you clean their tongue the night before, and you're like, oh my god, they wake up and it's terrible. That's because they opened their mouth to breathe or to compensating for breathing because they could not breathe through their nose, or they didn't have the lip posture to close to a completely 100% breathe through their nose. So that's one indication. Of course, another indication for bad breath is gut problem. And most American have gut problem one way or the other. And so the mouth is beginning of the gut. And so if you have bad breath and you're doing mouth taping and you do nasal rinsing and you do flossing, brushings, and tongue cleaning and oil pulling, and you still have bad breath, stop blaming yourself and start working with a functional doctor to figure out the root cause, which is a gut problem. It could be a food sensitivity, it could be a overgrowth bacteria, it could require some tests. And instead of just taking more supplement and do things on your own, you need to have someone to guide you in this process. And I'm a big fan of testing and
Yes.
evaluate and retest, because otherwise you're just guessing and you're wasting so much time and you get frustrated and you give up. And
Yes.
so, yes. And so that's usually the way we're ruling things out first. And bad breath equal mouth breathing. If we fix that and the bad breath is still there, that means it's a gut problem. So we
Yeah.
eliminate and really cheap and effective way versus go buying tons of supplements and then do all the tests and then realize that, oops, I've been mouth breathing my whole life. So,
Yes.
yes.
I love that. And we talk about the gut too, and identifying things like H. pylori,
Mm-hmm.
identifying imbalances of very aggressive organisms. Something that we see is in some children that have an immune abnormality called pediatric acute onset neuropsychiatric syndrome, PANS, or
Yes.
PANDAS, which is a group A beta hemolytic streptococcal infection, that these are children who get strep, and it may not be in the nose or the throat, it's the gut, or it could potentially be skin, but it's an autoimmune attack on the brain. But what we have found, if these children whose immune system doesn't function properly, and I think we alluded to this a little bit, the thought of removing tonsillar or adenoidal tissue. Why would we do that if it's a first line of defense? But we found that if the immune system, if you identify that it doesn't work, like about 25% of the population has a broken immune system, the tonsils many times will be very, very small, but they will have a horrible biofilm within it. And like yourself, as a biological dentist, you're checking that biofilm in the mouth. We see that coming out of the tonsillar tissue and identifying in little children something called Fusobacterium nucleatum, which is causative in Alzheimer's and dementia and all these other things when it's there in large quantities. We know that in small quantities. I'm going to let you opine on that just a little bit, Katie, about
Yes.
Fusobacterium nucleatum. But I
Mm-hmm.
was shocked. Well, not shocked, but it just really drove home. We did the right thing by taking out these tonsils and adenoid, because those bad bugs punching holes in the blood-brain barrier, making these kids violent and anxious and just so sick. So I'm going to let you, as a biological dentist, tell us a little bit more about some of these nasty bugaboos that you find in these people, that it's a gut and it's an airway issue.
Yeah, I'm so glad you brought that up because first and foremost, I'm a child benefit from tonsillectomy. I got my tonsil removed at 7 after years of my parents trying to figure out why I'm not doing well in school, why I could not pay attention, what's going on, and especially wetting my bed every night. It was such a big deal. It was embarrassment, right? And our parents, especially my parents in the '80s, did not know anything about airway. did not make the connections between ADHD and bedwetting and attentions and learning disability with the swollen tonsil and airway, limitations and issues. And so I got lucky in a way that they could not treat my tonsillitis with antibiotic, even though after they bombarded me with so much antibiotic, and they decided that, you know what, let's just take her tonsil out. And that was 7 years old. I remember that's the only surgery I had is tonsillectomy. And my life changed. I became number one in my class. I slept through the night. I stopped bedwetting. And my parents just like could not make the connection either. They're like, oh, great, awesome. I think she's grow. And so I'm so grateful for whoever make that decision, my parents to follow through with it. So when the child's suffering so much and that there's no way you changed diet, you did the laser, you did the ozone, and you could not shrink that tonsil, it's time to let it go. But when I was 7, there's no one doing any saliva testing or culture testing. Today, we as a biological dentist, every single patient, doesn't matter their age or their sex, we test their saliva under number one, the microscope, the phase contrast microscope. And number two, saliva testing that we send out to pathology lab where they will tell us the FN. And 5 years ago, we think FN was just innocent. We're like, oh yeah, everyone have FN. And now we're like, no, we need to treat this because it's also associated with colon cancer. It's also associated with a lot of brain activity issues. So I love that we are testing it. And as long as the kid can spit into that collected tube, we test it. And as long as we can collecting the biofilm and put on the microscope, we show it. And because just like when I brought my child in, doesn't matter if she's 4 or 1 or 2, you look at the blood work and you say, okay, this is what we need to supplement and optimize. You go to the dentist and you don't get saliva test done and you don't get to see your saliva in the microscope. That means they're also guessing and not testing. So these days, though test is so non-invasive, it's so quick and easy that you can actually collect saliva and testing for the FN and knowing the quantity also. And so the follow-up become easier when we do the homework, when we having the goggle with salt water and rinse and floss and tongue cleaning, and they come back and their numbers improving. And
Yes.
so, but I do agree with you. If the child do everything, the parents do everything, and getting the tonsil removed is not the end of the world. For me, it's life-changing. And so when
Yes.
parents telling me like, oh, I tried to avoid it, I actually told them, look at me. I had my tonsil removed at 7, and I wish they removed mine sooner.
Yes.
Now that I
Yes.
know what my parents did not have no clue about all my symptoms. And so you have time to really change that child life by removing that tonsil and still be able to give them a good life, a healthy life.
Yes. Oh, I so appreciate that. There's something interesting, even if a child cannot expectorate or spit into a vial, and some insurances will cover this and some will not. It's not hellaciously expensive, but it's a swab and it's a DNA analysis and it's next
Awesome.
generation sequencing, very similar to what you
Hmm.
have. And it gives us an idea. And so it just guides our care a little bit. So that's really encouraging to hear. So the fact that both of us love to get to the root of things, it's so encouraging to hear, Katie, what you do at your practice. And if you, as a biological dentist, if you're looking at a whole family, you alluded to this not just at an early age, but what are some of the things as a biological dentist that you would encourage families to not miss some opportunities to optimize their dental health, which, as we know, the mouth is the beginning of the gut microbiome. So I'd like to hear you just kind of tell us how you would talk to the family about that if they were brand new at your practice.
Yes, it's a big question because every season of life we see different needs. So I'm going to cover this from, the children to the parents. But number one thing is we always want to remind people normal is not optimal. So when people come in and say, I have no pain, I don't have any issues. have you dig deep enough? Oh, I eat everything. I have a standard American diet. So every time they say something in that line, we said, great, here's the thing we would like to share with you. For your children, we would like for you to watch them when they sleep, to make sure that they close their lips, to make sure you are helping them with the flossing and the brushing, because the child hand skills are not as good enough. So you can let them play with it in the morning and help them having that habit, but at night you have to follow up would go in there and do it for them. Because I think as a mom myself, I have a 10-year-old and a 4-year-old. I'm still in the bathroom with the 10-year-old, watching him to make sure, because teeth are bone. And now he start having permanent teeth. You don't have another set of teeth after that. So as a parents, we have to take that ownership, also helping them, not do it for them all the time, but supervising and checking and watching them when they sleep. Also, how they eat at home is what we buy on our grocery trip. So be mindful what you're buying and looking at their genetic to see what they can eat, what they have sensitivity with, and lower that inflammation from early on. And also create that habit at home, because when they go outside, they're also making good choices without you there, especially when they go to college. And so I think with the child is a lifelong habit of choices that you make it at home, and then when you go out to the world, you're making that choices for yourself, and then later on when you have family, that carry on. And then for parents, most of parents unfortunately put the kid first. They would do everything for their kid, but then for themselves they would wait until it's become emergency. They said, I can eat, I can talk, I don't have pain, so I must be okay. And that actually what got us in trouble to begin with, because we're missing opportunity to prevent chronic diseases, like things that, tied it to, the heart issues, cardiovascular, autoimmune, cognitive decline, is because we're missing opportunity to catching it early. And so for parents, if you haven't got your DNA analysis done, get it done. Because it's also telling you if you have high risk for something that you can actually changing the lifestyle, aka epigenetic. So everyone, I tell every patient, you need to have your genetic look at. Don't wait until when you're 70 or 60 and then like, oh, I'm get hit with dementias or Alzheimer and now I'm gonna try to reverse it. It's a lot harder when the symptoms are showing up. So with parents, don't wait until you're hurting, don't wait until you have issues. Look at your family history, look at your DNA, and then actively showing your children you making effort. Like for us, a lot of time when parents say, oh, I want my kid to be active, but they're not active themselves. I want my kid to eat
Yes.
healthy, but they're not eating healthy themselves. They drink soda or they drink, alcohol. And I think that's the best parenting, is just modeling. They're looking at you, how you eat, how you, having your activity, and then the kid modeling that. And so if you can take care of yourself, your family will get healthier because your children will model that behavior. So that's the message I have for the whole family. Preventions, don't wait until it hurt. And if you don't know what you don't know, then seek provider that actually know prevention is more than just looking at the 2D x-ray. CBCT will tell you more about the wisdom teeth area, about root canal teeth that doesn't hurt, but
Can
infected.
can you tell our listeners what CBCT is?
Yes. CBCT cone for cone beam technology, and that is a 3D dimension X-ray. So the regular X-ray you have at the dentist on a routine checkup is a 2D, like a photo. We cannot see a different dimension of that image. But if you have a cone beam 3D, then that will help for us to slide that image into so many different view. And most of the time we will detect infections or abnormality before it becomes symptomatic. Because I have so many patients when they have a huge abscess in their jaw and they're like, how come I have no pain? And I said, yes, the body is really smart, but this is the area that it's been, basically hidden. And so those hidden infections, the one that cost you the most, which actually will causing heart attack and stroke in patients that don't know that they have a hidden infection. So for me, prevention is the key. Knowing your body, personalized approach, and not doing things that just because everyone else is doing, and I'm going to do the same thing, right? Even to the workout type, to the food type, you have to know what works for you and for your kid, not just because everyone on Instagram doing the same thing. And so I think that's so the key thing that work for the whole family is knowing your unique gene, and knowing how to apply epigenetic in your life, and then
Yes.
preventions.
Yes. And I so appreciate parents modeling it. It's interesting when you have kids, like for me, I did not learn about functional medicine until I was around 50. And shortly after that, I attended my first functional medicine course. And I told my husband, I said, this is what I want to do. And I had never branched off to do something like that. And our family has changed. I was a completely different mother to my first two children than I was to my last two. And, just the struggles that we go through, your body, the fatigue and your battle with infertility, and then finding out about heavy metal toxicity. And it totally changed the trajectory of your clinical practice. And now you're blessing the lives of so many people. So, and for parents not to neglect themselves, it's true. They lay down their lives for their kids. And that's when we have the conversation. You have to put your oxygen mask on, but you see you're in crisis mode now. So let's back up a little bit and let's try to keep this simple and create a sanctuary at your home. And it has to be both mom and dad, both parents, or, to get that dialogue going. So when they treat root cause, and this is the Get to the Root podcast, and your approach is getting to the root of dental challenges and things like that because it involves the entire body. So, and what I love too, Katie, about you is that you always have such a spirit of gratitude and you light up the room. And I love how you frame it. And your children are a beautiful reflection of you and your husband. They are the sweetest, the most respectful, compassionate kids. And I know that you are, uh, working on that dialogue on a daily basis. It's what are we grateful for? And hey, let's greet so and so. Hello. And they're just engaged, and it just goes to show,
Yes.
more is caught than taught, and we have to be intentional about what we do. And thanks again. I'd like to thank our sponsor, Fagron, because you've alluded to this numerous times. It's true. Our wellness blueprint, there's another one called the newborn panel. We have separate, smaller panels, but the blueprint really does give people a roadmap of where they're going and where their vulnerabilities are. And it's how to support their bodies and how to create a beautiful environment. Now, it's interesting what you said when your kids go away to college. Out of all my children, 3 out of the 4 have drunk the Kool-Aid. My youngest is just about to be 20 and certain things, but I thought it was a win when I found that she had taken her cell phone and put it under the bed. Because I'm like, just get it away from you. And so that was step number 1. So we'll see if she'll get it 6 to 8 feet away. But it's so interesting. We just have to model it. So thank you for that. So as we wrap it up, we want to remember that normal, as you said, is not optimal.
No.
And we need to look for opportunities. And thanks again so much for being our guest and giving our families, our listeners, some concrete tips and tricks to partner with their children, and then also how to identify potential airway restriction in their newborns. So
Yeah.
thanks again.
Yes, thank you, Paula. And I have to say, I don't know, I think it's been so long ago, but I don't know, Paula, you remember. I just want to say it here so I think our listener and audience can see it, that my first encounter with you was really life-changing and life-saving because I was sick, I think in June of 2018, and then my son got sick in April of 2019. And I called my friend who also a functional medicine doctor, and I said, who should I take him to? Because I know this is possible something that's similar. And he said, Paula, the only one in the entire Houston area I would take. But I called your office and you super book. And and I was a desperate mom at that point. I did not sleep for like 7 days, I think, because he was in fever. So I drove him down to your office and I wait and I wait. And you finally saw him out of mercy and compassion. And I was so grateful. I'm still kind of emotional talking about it, but this is why when you if you get an opportunity to watch this and see this, no one come to our life as an accident. So I'm forever grateful for that. And so that's the reason why we become lifelong friends. And you're gonna take care of them even after they graduate from high school and go to college. because I'm so grateful for your care and for your love and for what you do for patients. And we have so many patients come in, and if they tell me they see Dr. Paula, that I know they're in good hands. So thank you again for taking care of Bailey and save his life.
Oh, well, thank you so much for that. It's so funny what encounters with other providers, the difference that it makes and life-changing. And I give all the glory to God for that because, the way I look at it, apart from him, I can't really do anything. It's like you can have all this knowledge, but if it doesn't
Mm,
translate to what you do. So, Katie, thank you for those words of kindness and love. And I feel the same way about when parents or patients tell us, "Oh, we see Dr. Toe." I'm like, "Oh my gosh, you're in such great good hands. She'll take great care of you." So thanks again for being
thank
on
you.
today. And if you have a chance, I know that you have people fly in from out of town to see you. We both love ozone, what ozone does. Not you use dental ozone, we do it IV. But this is just a beautiful encounter with you and who you are and what you do. And so what you see is what you get with Dr. Katie. She's amazing. So thanks again
Thank
for
you.
joining us today.
Thank you for having me.
All right. You take care.
Thanks for joining us at Get to the Root with Hope for Healing. If this episode helped you, follow and share it with someone who needs it, and leave a review. It helps others find us too. For a free consultation, visit our website at gettotheroot.com with the number 2 and schedule a welcome call. We'll see you soon.